You know, it's so easy to push your healthcare needs to the bottom of your packed to-do list, but it's never a good idea, especially when making a mistake could cost you a lot of money, such as during Medicare enrollment. Mark Lamkin with Lamkin Wealth Management is here to talk about the 5 biggest mistakes that you can make with Medicare, but you're going to focus on, Mark, the things that we need to avoid.
Number one reason people continue to work is health insurance, right? And Medicare is one of the most complex topics that we've ever covered together in the last couple of years. Let me say this first. Every state has state health assistance. It's called shiphelp.org. If you don't know where to start, that's the perfect place to start because there's so many things that can go wrong.
Right. So mistake number 1, underestimating the costs of traditional Medicare.
Yeah, so half of Americans take Social Security at age 62, right? If you sign up at 62, at 65, you're automatically going to be signed up for traditional Medicare. And that may not be the right thing for you because you've got 20% that you've actually got to cover some deductibles. Part B is income-based. Some people pay 100, some people pay 500. But traditional Medicare is you've got the A, which is hospital services, B, which is physician services. That's based on your income, so you got to be really careful there because you can really get taken to the woodshed, so to say there. And D are prescription drugs, also based on income. So if you don't know what you're doing and just get roped into Medicare, you could have a very expensive plan if you're not careful. Very careful here.
Like you back up to mistake number 2, underestimating the costs of Medicare Advantage.
Right. So Medicare Advantage is also known as like supplemental insurance. And so they're going to group A and B together. But here's the catch. You've got to stay in network with that Medicare Advantage program. That's also Medicare C. And with that, you can lower those costs. They can cover those out-of-pocket expenses. But again, if you don't add D on there, which are prescription drugs, or if you go out of network, you can be really penalized. So it's really important to understand that Medicare Advantage program. Most Americans do that if they have some savings or income, and that can often be the best choice. But you got to be real careful on what you pick for you and the income.
Was mistake number 3, if you choose traditional Medicare, do you need to make sure you have Medigap?
Yeah, so that's almost kind of like Medicare Advantage, but so if you are enrolled in traditional Medicare because you're maybe a lower income senior, that Medigap, what that will do is help pay that 20% coverage or pay that deductible. But Medigap insurance is something that if you don't have Medicare Advantage, I encourage you to look at that Medigap because that supplemental insurance can really help you, especially if you're lower income. You got $1,600 out of pocket, you got 20% coverage, you got to pay for prescription drugs. So that Medigap insurance, it becomes really important because, listen, when you're in your retirement years, healthcare is the most expensive thing that you have. Number 1 reason to work, number 1 reason seniors go bankrupt. I mean, this is really important.
You talk a lot about the prescription coverage, making sure you add that on. How easy is it to forget to add that on? Is it not in plain sight when you sign up?
Gosh, that supplemental.
Or is it the fine print?
Yeah, like that.
I mean, that's the most important thing.
It is. If you go to like just the traditional, they'll include that. But like the Medigaps and MedAdvantage, you've actually got to add that on. And if you forget, you and I both know how expensive prescriptions are. And if you've got that Part D, that's $5 or $10. Well, if you don't have that, can you imagine paying $1,500 a month or something if you've got a bad prescription or something? So don't forget that Part D or that prescription coverage.
Mistake number 5 is not checking out your broker. So
listen, this is really important. So the brokers are incented to get you to sign up for a more expensive plan. The government is going to pay them $400, $500, $600. They will pay them more if they get you an expensive plan. So when you're talking to a broker, I'm not saying that they can't be helpful because they can. They know this inside and out, but you've got to take control. You've got to understand because they're going to upsell you. And when they do, they get paid more. So just understand that going in. But I would encourage you, the number 1 resource, shiphelp.org. Nonprofit, free counseling, Medicare, caregivers, family members, your adult children can get on the phone and help you. That is a fantastic resource. And they know these coverages backwards, forwards, and sideways. This is a number 1, this is for the rest of your life, paying this, it literally could bankrupt you. I can't explain how important it is and to seek help in doing it.
All right, Mark, thanks so much. Now, for more information, just go to lamkinwealth.com or call the number on your screen. We're coming right back.